And of course, as families are committing to stay home to prevent the spread of COVID-19, also you're wondering, how in the world do I keep my family safe? And maybe you have a newborn at home, and how do I get them vaccines? That's why we want to bring in Dr. Neil Davis. He is a pediatrician with Intermountain Healthcare. Dr. Neil, good to see you again. How are you?
I'm doing well, thank you.
Good. Now, this is a hard thing because we are trying to stay home, but how do we also find the balance between keeping our kids healthy and when to know when to go to the doctor?
Yes, it is a really important thing that children, and especially young children, are receiving critical medical care. And we
Right.
know that's particularly true for newborns and young children for childhood vaccines. We don't want to trade one pandemic to a different epidemic
Right.
in the future.
So, how do parents go about doing this? I'm sure it's different based on which hospital or clinic they're going to, but what's the best way to go about all this?
Great question. We are fortunate that the Centers for Disease Control and the American Academy of Pediatrics have both put out statements talking about the importance of these particular services for children, medical
Mhm.
services, as well as different practices that can be done by
Mhm.
medical offices to lower the risk of getting COVID, the coronavirus, while maintaining these critical needs for children. So I have a role as a medical director for community-based care in pediatrics for Intermountain as a system. And in that role, I get a chance to interact with pediatric practices across the state. Every one of those practices is doing innovative things to do exactly what we talked about, lower the risk and create opportunities for critical care.
What
And
are some
that,
of those that they're doing?
you bet, thank you. Some of those things can be separating the times when kids that are sick and kids that are well come in. For example, have the well kids come in the morning. Many offices are also separating physical space within their offices.
Okay. Mhm.
Some practices are even using different locations for well and sick services. So there are a myriad of things that can be done. The main message is children and newborns need these critical services.
Absolutely.
Contact your child's medical office, find out what they're doing. They're doing important things to make sure these things can get done.
And thank you to all of your staff and everyone around the state and the nation that are doing their part to really, do things that have never been done. And in a pinch, trying to make sure that we're all safe and make it so that people can get into the clinics that they need to. So thank you for that. And if people want more information on Intermountain and what you are doing for the pediatrics, where can they go?
Intermountain has a website at the intermountainhealthcare.org website that has information on COVID. That's a good place to go. Again, the Center for Disease Control and the American Academy of Pediatrics have great information as well. But the main message is contact your child's medical office. Whether they're
Perfect.
Intermountain or not, they will have information to support you and your family.
Great. Well, Dr. Davis, we appreciate it and good to see you again. Thanks.
Oh, likewise.